Hello, my name is Dr. Jeremy Steele here at Steele Chiropractic, and today I'm going to be talking about the neck. Now, every single day I see people with neck problems, and sometimes these problems can affect their lives dramatically. It can affect their activity level, the things that they love to do. It can affect the time that they spend with their families. And of course, it can affect their work situation as well and their ability to make a living and make money. Now, I'm asked questions every single day, and there is so much to cover. I'm going to do the best that I can here in a few minutes. But if you have any questions, please feel free to contact me. I'd love to talk with you. So let's get into it. Now, some of the symptoms that people can have when it comes to neck disorders is, of course, neck pain, where it just hurts to move or to rotate. Sometimes they'll feel stiffness on one side and not be able to move to the other side. Also, rotator cuff problems. It can affect the blood supply and nerve supply to the rotator cuff muscles and, of course, cause damage there and lead to things like rotator cuff surgery. Of course, chronic fatigue, fibromyalgia, leading down to the nerves in the arm, tingling and numbness, and affecting carpal tunnel syndrome. Can also affect things like our ability to breathe. And going back up into the brain, it can affect our neurological disorders as well. It can lead to, or it's a contributing factor in things like multiple sclerosis and Parkinson's disease. These aren't simply autoimmune disorders. So today let's take a look at a few exercises and things that you can do on your own to help take care of your neck and look at where some of these problems occur in the first place. Now, there's two ways that these problems can occur. One is big traumatic events that can happen. These are things like car accidents where we get whiplash, dramatically distorting the vertebra, the ligaments, the muscles in our spine, and it's affecting our nervous system as well. The other is chronic repetitive disorders. Now, these are things like sitting at a computer for several hours a day with our head forward. Oftentimes, it doesn't only bring our head forward, but it brings a rotation or a head tilt as well. This is a coupled motion. Maybe you know somebody who has a head tilt. Maybe they compensate with a high shoulder on one side, or they're always seeming to tilt their head to one side. This is that coupled motion related to that disorder. Sports injuries as well. We take care of people like that every single day. And if it is a big traumatic disorder, it's really important that you see a corrective chiropractor to take care of your spine immediately and make sure that everything is lined up properly and everything is looking okay so that you can have the best outcome from that incident. The other way is the chronic repetitive disorders, which is people slouching for several hours a day, either at the computer, typing, maybe slouching at the couch at the end of the day. Also, the way that people sleep. Sometimes people sleep with a couple pillows under their neck, propping their neck up so they can look at their smartphone or watch their TV, and they fall asleep in this position. This can dramatically affect the neck as well. And stomach sleepers. If you're a stomach sleeper, you should really reconsider this and see a chiropractor and try to figure out why you sleep in that position in the first place. But that really affects the top bones in the neck, and it can affect the blood supply to the brain and also the cerebral spinal fluid. This is the fluid that bathes the brain and gives the brain nutrition. And when that's affected, it can really lead to long-term problems in the future. So let's take a look here. This is a plastic model of a spine, of course, not a real one. I saved those for the cadaver lab where I used to teach anatomy. So the neck has 7 vertebrae, and in between the vertebrae we have discs. That's just this foam material here, but it's a nice disc material on a real body. And in between the vertebrae, if we can see here, this red, these are the arteries that supply the brain, the back of the brain, and some of the main brain with blood, as well as our carotid arteries in the front. But these ones are important because they go through the spine. It's been shown that when we lose our cervical curve, now this is a normal cervical curve here, but when we lose our cervical curve, it distorts the blood flow within the spine. And also if there's a rotation here, especially on the top bones of the neck, you can see that it can distort the blood supply to our brain. So we want to have a nice normal cervical curve, okay? And one of the big reasons that people lose that cervical curve these days, especially with kids, is looking down at their phone constantly for minutes or hours a day. This is stretching out the muscles in their spine, the ligaments in their spine, and really causing a distortion in there. And over the years, I really believe that the younger generation today is going to have quite severe problems in the future due to the fact that they're looking down every day. Now, I'm not blaming the parents for this, but I mean, you go out to a restaurant and you'll see that the parents give their kids an iPad or an iPhone to look at for the course of the hour or however long they're at dinner, and the kid's just looking down constantly. This is putting constant strain and constant stress on their spine, causing that distortion, causing the problems with the nervous system, causing problems with the blood flow, causing problems with the cerebral spinal fluid going into their brain for brain development and proper function. And it's, of course, over time, this can lead to many symptoms and health issues within the body as well. So let me show you a few exercises and some things that you can do. The first one, which I really like, is just making sure that your head is back so that your ear is over your shoulder. For every inch that your head is forward, it doubles the weight of your head. So the pressure doubles. So if your head is 10 to 15 pounds and your head's an inch forward, that puts about 30 pounds of pressure on that disc, on the ligaments, on the tendons, and of course on the nerves and the blood supply as well. It increases that. And when our head's all the way forward, it puts a lot of pressure. Now, if I'm just doing this temporarily, that's not really going to cause much of a problem. But it's the long-term repetitive nature of being in this position that deforms the spine over time, puts a lot of stress on the nervous system, and can cause those problems. So one of the exercises that I like to do is simply putting my hands down the back of my spine here, and I'm not putting it on the spine, I'm putting it to the sides of the spine and just extending my head, and I'm lifting my chin towards the ceiling, just like that. And I'm holding that. And you can do that several times a day, especially after sitting at a desk. This is going to take some pressure off of the spine and help to bring back that curve just a little bit, at least temporarily, until you can see a chiropractor if there are some major distortions. Of course, this may not solve the problem, but it's going to assist in helping you to function better and to feel better and to support any care that you are getting. So bringing the hands down the spine, extending the head up, lifting the chin towards the ceiling. Now, what you don't want to do is just extend your head all the way back. The muscles in the front of the neck aren't that strong, and so pulling the head forward can cause a strain, and it can also put some strain on those top bones and top nerves in the neck. So we want to support here, grab our traps, pull down with our shoulder or with our elbows, and extend backwards, lifting our chin towards the ceiling. Good. And you can even use your hands to help assist your head bringing up your head if that's uncomfortable. Sometimes people can use a towel. You just wrap a towel around your neck and do that same exercise, lifting your chin towards the ceiling, not trying to extend your head back as far as you can, just lifting that chin up. This is something that you can do several times a day. Another one is when you're in the car driving, go ahead and push your head into the car seat. This is going to help engage those muscles and maybe give them a little bit more strength over time to help stabilize your neck and your spine. So just pushing your head back into the car seat, maybe extending it just a little bit to help engage those muscles. Of course, try not to do this while you're driving or being distracted, maybe at a stoplight or at a stop sign just for a second. Or if you're just waiting in your car, you can do that. Or you can stand against a wall and do that as well. It may not be as effective. That's just a little thing that you can do to help support your neck. So those are a couple exercises, a couple things that can go wrong with the spine, and a few symptoms and things that can be a result of those problems in the spine. Again, if you have any questions, I'm Dr. Jeremy Steele at Steele Chiropractic. Please feel free to contact me anytime. I'd be happy to talk with you. And I wish you the best of health, and I hope you have a wonderful day, and we'll see you soon. We'll see you on our next video. Bye-bye.